Good day. My name is Dr Ighodalo Omofuma. I'm a general surgeon and the head of surgery department at Nisa Premier Hospital, Abuja. Cancer, first of all, is a condition in which there is growth of abnormal cells that grow uncontrollably and destroy the tissue where they are located, and can also send similar tissue to distant organs. Breast cancer is cancer that is occurring within the breast, usually affecting females, but can also in rare occasions affect males too. Surgery plays different roles in the management of women with breast cancer. First of all, surgery is important in making diagnosis. The way in which diagnosis is confirmed that a woman has breast cancer is by pathology. A biopsy is usually carried out to obtain samples for pathology to be done on the tissue that is suspected to be cancerous. So surgery has a role in obtaining that biopsy, and this can be done either through methods such as using a needle, obtaining a needle biopsy, or an incision biopsy. Surgery also has a role in treatment of women with breast cancer, and this is for two main reasons. The first reason is to cure the patient of the cancer itself, and the second reason is, when cure is not possible, to offer some form of palliation to the patient. So surgery is important to try and achieve a cure of the patient for women who have been confirmed to have breast cancer, or to offer some form of palliation when cure is no longer possible. The third role of surgery in patients with breast cancer is usually for reconstruction. That is not usually carried out by a general surgeon. Usually we partner with the plastic surgeons for that purpose. So breast reconstruction can be offered to women who have had surgical treatment for breast cancers. So surgery plays either of these roles in the management of patients with breast cancer. There are basically two types of surgery that's usually offered to women with breast cancer. First of all, surgery is part of a multimodal treatment of women with breast cancer. So surgery is not the only way that women with breast cancer are treated, but it is the main, plays a central role in the treatment of women with breast cancer. There are two types of surgery that are usually given to women with breast cancer. One is breast conserving surgery, where the whole of the breast is not removed, and this is usually offered to women who have breast cancer that is in its early stages. And apart from that, there are some special criteria that need to be met before this is offered to patients. This came about as against the historical radical treatments that were offered initially for breast cancer, because we found out that if a patient comes at a particularly early stage and is offered breast conserving treatment, in other words, the whole breast may not be removed, but the cancer and surrounding breast tissue is removed, it was found that the women didn't do differently from women who had radical treatments, in other words, had the whole breast removed. However, this is not ideal for all patients. There are some patients where this is recommended, and then there are some patients where this is not recommended. And so we have breast conserving surgery for breast cancer, and then there is radical surgery for breast cancer, which includes removal of the entire breast and also the lymph nodes in the axilla, which has been the mainstay of surgery for cancer treatment or for breast cancer for many years. Removal of lumps from the breast. First of all, in women who have breast cancer, it goes without saying that if the cancer is not removed, then the patient is likely going to suffer from the effects of the cancer progressing in her body. But this question is important, especially for women who have lumps that would not think are cancerous. In other words, they have benign breast lumps. These lumps are often removed because of, number one, is for diagnostic purposes. When you remove the lump, you can send the lump to the lab. The lab can assess the lump and confirm that the lump is actually not cancerous. So for purposes of diagnosis, it may be important to remove breast lumps that are not cancerous from the breast. Another reason is patient anxiety. A lot of women are a little bit anxious of carrying something within their breast which they feel is abnormal, even if they are counseled that this may not be a cancerous lump. They may still have some anxiety about it. So it's usually better to remove the lump and then to remove our anxiety. And then we can also further go and confirm that this is not breast cancer, which will further allay her fears. Another reason is some benign breast lumps may actually cause some disfiguration of the breast, especially if they attain very large sizes. So apart from the fact that she's carrying a normal lump, it may distort the normal appearance of the breast, and so this is not usually acceptable to both the patient and to the managing surgeon. So usually for those reasons, we do advise that breast lumps be removed. Okay, so going back to what I said before, mastectomy is surgical removal of the entire breast, and this is usually done for patients with breast cancer, either for cure or for palliation. Mastectomy is usually advised when a woman has a more advanced, locally advanced form of breast cancer. In other words, a breast cancer, for how we make this determination, we stage usually breast cancer from stage 1 to stage 4. Usually, breast cancers are usually at stage 2 or stage 3 we offer, or even in some cases where it is early, we offer mastectomy as treatment, primary treatment for breast cancer under certain conditions. So mastectomy is usually advised when the breast conserving surgery is not an option for that particular patient. The patient does not meet the criteria for breast conserving surgery, and you are aiming to treat the patient either for cure or for palliation. In those cases, then it is advised that the patient has a mastectomy as part of multimodal treatment for breast cancer. Okay, so usually first thing is that the patient is seen by it's advised that a patient who is suspected to have breast cancer that may require a mastectomy or other treatments, surgical treatments for breast cancer, usually has to see a general surgeon. Diagnosis has to be confirmed pathologically, and then the indication for the surgery is met. Once that is done, then the patient is prepared to have surgery. First of all, that the patient understands the diagnosis and understands the need for the surgery, the surgical treatment of the breast cancer, and then the patient has to be made fit, or the patient has to be fit for the surgery. So that includes meeting with the anesthetist and other physicians that are necessary in the assessment of the patient to make sure the patient is optimized for surgery. Other preparation may include meeting with the plastic surgeon for patients who would like to have breast reconstruction after surgery. Some of the assessments can start before the surgery for treatment of breast cancer. In fact, in some cases, plastic surgeon and general surgeon will operate at the same time for the patient. So the breast cancer is removed by the general surgeon, and then breast reconstruction is done immediately by the plastic surgeon using the same general anesthesia. Also, preparation of the patient includes a patient to know the details of the surgery, to know the possible complications, and also to know the cost, the financial cost and the burden that they will bear in going through this treatment. So all these are done prior to when the patient eventually comes for the surgery. We do find that there are a lot of misconceptions about what breast cancer is and about the treatment that especially surgical treatment for breast cancer. First of all, one great misconception is that breast cancer usually, people only worry about breast cancer. Women usually only worry about breast cancer in our environment when they have breast pain. This is one of the greatest misconceptions. Breast cancer usually is painless when it is at its early stages, and it's at those stages that we can usually offer curative treatment. So the most common presentation that a woman will have that may mean that she has breast cancer is a painless lump that she feels in her breast. Once a woman notices that she has a painless lump in her breast, she should go to meet a qualified personnel, which usually is a general surgeon, to assess her to know whether it is possible she has breast cancer, or if it's a benign condition that may not require radical treatments. The second misconception is that the treatments for breast cancer, surgical treatments, are always radical, that they must remove the breast in every case. That is not true, and that is why we emphasize early presentation and screening, because if you come at an early stage and you meet the indications for treatment, the whole breast doesn't have to be removed, and that is available even at Nisa Premier Hospital. And then one other misconception that we found a lot of people have breast cancer, that if you have cancer and you offer surgical treatment, that you are going to speed up the growth of the cancer within the breast or within any other parts of the body. Well, this is also a misconception. The patient who has had breast cancer surgery may still come down with maybe metastasis to other organs if that had already occurred at the time the patient had breast cancer. But it is not the surgery that caused the disease to advance in the patient. It just happened that in that patient, the disease was already advanced at the time the diagnosis was made. So that even if surgery is offered, it is not usually curative at a late stage. So at a late stage of breast cancer, surgery is only palliative, which means that you are only prolonging the life of the patient and making the quality of life better for the patient with the treatment. You are not likely going to still cure the patient of the cancer. So the message you take away is that cancer treatment can be curative when the patient comes early, and that treatments do not have to be radical as a lot of people fear. So women should present early as much as possible, and then they should go for screening where it is available. So thank you.